Hi, and welcome to the show. Subscribe at kevinimity.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Justin Norden. He's a physician executive. Today's Kevin MD article is, Can Generative Artificial Intelligence Help Clinicians Better Manage Patient Messages? Justin, welcome to the show.
Kevin, thanks so much for having me here.
So we'll talk about your article in a little bit. Let's start by briefly sharing your story and journey.
Perfect. So Justin Norden, physician and computer scientist by background. I started out on the technical side, actually, doing undergrad in computer science, master's in computational biology focused on machine learning, and then came to Stanford for med school and business school. For me, what was interesting was coming in with this technical background, seeing what technology could do, felt like I kept banging my head against the wall of, I can't believe we do it this way. We could do better on differential diagnosis. We could do better on so many aspects of technology and in patient care. And so that's kind of been this thread that's kept me going ever since. I started to take a number of clinical detours, was part of the team helping launch the Stanford Center for Digital Health. We're doing some of the first telemedicine visits out of Epic, jumped over to Apple on the healthcare team, helping to grow and see some of the clinical projects there, and then launched a company called Trustworthy AI, where as someone who's been fascinated by technology and what computers could do, I knew there was going to be something different needed if we were going to do this in a healthcare setting. Ended up kind of going from there. I now work in venture capital, work with startups, but then also teach at Stanford. I'm on faculty in bioinformatics, where I teach on digital health and AI in medicine. And with everyone, and I'm sure you've had a lot of guests already talk about what's coming, I'm completely enthralled by what's happening. And the key question for me is, how do we bring this to our clinical champions around the world safely?
Absolutely. And as you alluded to, the promise of generative AI is wide open. Right now, it's a Wild West. I interview so many physicians about potential applications of large language models. So I'm interested in hearing your take on it. And you talk about that in your Kevin MD article, Can Generative Artificial Intelligence Help Clinicians Better Manage Patient Messages? So tell us your article and your approach.
Absolutely. So in very short, yes, these tools will have a transformative impact across all of healthcare. But then the next part is, are they having that impact today? The answer is no. We don't yet know exactly how they perform. These tools are new. We haven't kind of figured out a way to manage the risk and understanding, but we see the potential, and it's going to take all of us working together to take those next steps. So the purpose of this article that co-wrote with Spencer Dorn, who's a physician, vice chair of medicine out at UNC, is someone who's just written, and we've talked a lot together, and he's written a lot himself as well on what are potential ways we can start to use these tools. And so what we wrote in this article was just expanding a little bit more on how we might use these tools for, in-basket messaging, getting rid of that pajama time, which is something that just has been a burden on so many physicians. And while lots of people talk about maybe just, drafting a note or a response to a patient, there are so many other applications as we go before that even gets to, a clinician's inbox, and after, to triage beforehand, help label so it goes to the right person, draft that response, bring in the right pieces of information. And so, while people are most used to this, chatbot interface of ChatGPT, the potential for these tools comes in so many other non-chatbot related features.
Absolutely. I'm super interested in hearing that. I'm a primary care and telemedicine physician. And when you say things like inbox, patient messages, and especially in Epic, it just keeps on growing. You could never get back to the inbox zero. So hearing these AI applications to make our lives easier is certainly something that many clinicians are interested in. So tell us how this can happen.
Absolutely. So what we outline and how this will happen in the future, well, I'm sure will be totally different than what we're outlining here today. But we just wanted to take a stab at a few steps for how these could happen. So there's a number of different points in where we could use these tools to aid in the experience. And so part one is when the patient is actually sending the message to a clinician. We've all seen messages of varying quality and length and completeness. One of the things where a large language model could help is in actually, editing and understanding that message. Let's say we were missing key pieces of details. They mention a medication, but don't message a dose. There's a step before it even gets sent out or away from the patient where that message could be revised to make it more complete.
Hmm.
In certain circumstances, maybe even if it's a medication refill, something super basic, you could actually even skip needing to go all the way through all these other steps, which we're starting to see in other applications as well. But this first part is before it even kind of gets to the physician, let's see what can we add to make the message more complete, or is there anything we can handle information to give them? Hey, I heard you mention this, piece of question on your medication. Here's a piece of information. Did this solve your question? No, fantastic. How do we refine your message and keep moving? And so that's as a first step of how can we get the patient the right information and or get them to complete a more complete message so we can actually resolve that.
Now, would that
So
tool go into the patient's chart, like you gave the medication analogy? Would it go into patient's chart, look at their medications, maybe fill in dosages, or would it simply just reword the message to make it more polished?
both are options. Both are options, candidly. I think the first version from a technical perspective, far easier just to do the second of just,
Yeah,
hey, missing things in this and let's make this more polished. As we move forward, and I think as we go forward over these months and years, we'll see far deeper integrations of these tools where it is pulling up all that information from the chart and populating it.
perfect. All right. How else can
So,
they help?
Step two, so right, this is at the beginning, working with the patient beforehand. Step two is, okay, a message does need to be sent. It's a little bit more complete than it would have been before. Now it's actually, where should it go? Where should this message get routed to? Is this a automatic thank you note where we can send a response and we really don't need to waste your precious time, as a primary care physician looking through this and sending that? Should this go to your MA? Should this go to a different person on your staff? Is this a billing question? What does this message type look like? And how can I prevent as much as possible from going to you so you're just able to practice at the top of your license in your time? This has been a dream. A number of, academics centers across the country have tried this previously with many tools. And now with the tools today, the key difference is we are so much better at this that is going to add utility across the board. Previously attempts, it just hasn't been good enough. Messages weren't going to the right spot, but the technology is good enough now where we can route to a much better spot. Never perfect. These tools will never be perfect. And I think this is the key message, but we can get it to the right place. And if it's wrong, there's still a human in the loop to redirect it where it needs to go. So this is a big step of, is this urgent, non-urgent,
Hmm.
clinical, non-clinical, and then who actually needs to receive this message?
So I completely automate it because in my institution, for instance, we have a person going through inboxes to triage the urgency of messages. So you're saying with these large language models, we have the capability to do that automatically potentially.
Exactly. And from some of the early studies I've seen from talking to partners, we can actually do a better job than most of those people today. Because it's not a clinician usually who's reviewing this message. Maybe it's someone who's making a best attempt. And they're not perfect today, right? You'll get some messages that you didn't need to see now that could have gone somewhere else. And likewise, these large language models will also miss occasionally and give you the wrong message. What's different across these tools now is but they're probably better than that human triage in some cases.
Hmm.
And so that's what really kind of allows these tools to finally actually, give value, because for years and years we've seen AI fail again and again and again in healthcare. Promises of Watson, promises of everything before. What's different is the capability of these tools today.
All right.
Even though they're not perfect, they're now better in many cases than human performance.
All right. You're making the future sound pretty promising from a primary care standpoint.
Hope so. So the last step I'll just fly through just so we can finish this is, one thing that's really challenging is when you actually get this message. Now a message was refined, was deemed that it needs to go to you, Kevin. Now you see this message, you're dealing with, 10 hundreds of these now. Wait, who is this patient? What is their chart? What do I need to know? And instead of coming in blind, let's use these LLMs to summarize key parts from their medical record to bring up what is relevant or most likely relevant to that message. So that rather than all the clicks going around searching for that piece of information, can I have this message here and can I have a summary snapshot of the patient? So this is this next key step of information retrieval from the chart to get you what you need. And then finally, now let's draft you a message or a handful of messages to look at.
So when you say large language models, like, are we talking about something proprietary? Are we talking about something like GPT like? As you know, even within the world of large language models, there are many. So what kind of engine are we talking about behind the scenes?
Great question. So large language models is right the umbrella term. It's this, type of model. Sometimes people will call it foundation model, as these often take in images or other forms of media. And we'll see actually a lot more of that this year from all the big companies. Which one should healthcare use? Should they use OpenAI's GPT-4? Should they use Google's MedPalm? Should they use Anthropic's Claude? The jury's out. My expectation is healthcare will use a combination of these. For depending on your application, certain parts of these models will perform better, and certain ones will be closed source where we don't know, and OpenAI isn't sharing every detail under the hood of GPT-4. The other class of models that will get used in healthcare are the open source models. Meta is building things like Llama, there's Falcon, there's other models that instead of having to rely on OpenAI or Google, for example, healthcare systems will soon be able to, download these open source models, fine tune them themselves, and deploy it themselves where they can control every step of that process. So the jury's out. There's this open source versus closed source debate that is happening across AI broadly. And I expect for the foreseeable future, healthcare will start to use both. Over time, maybe healthcare and clinicians will demand we actually only want to use open source models so we can kind of control more of these steps, but we're not there yet. The field is evolving too fast to say for sure which direction we're going.
So how far are we from the world that you're describing? I just looked at my inbox before this interview, over 100 messages. So how long do we have to wait before your vision for automating the triage of patient messaging with AI?
So from a technical perspective, this is possible today. All of the steps I described are absolutely possible today, and have seen companies working on every one of them, or seen research projects working on every one of them. What is soonest and what physicians are really starting to play with now is what's available in Epic at a few institutions, where they're testing mostly this last step of drafting physician responses. And so there are studies ongoing. UC San Diego is a pilot site, Stanford's another pilot site, where this is happening today. All of these steps will take longer. That's the key question. And a big part of it is going to be how much, as a group, as physicians who are overburdened, we demand these things to happen. The earliest application of generative AI that I would say is really catching on more than this in-basket example is ambient documentation.
Mm-hmm.
This is the thing that, every prediction is wrong, but this is the thing that has already seen the fastest adoption because clinicians are demanding it. Wow, this can help me save time on my note. I'm now kind of going up the chain. Hey, I need this now. My friends are using this. Why don't I have this? And that'll be an application. As we start to see that more on more of these tools, adoption will start to follow. So technically this is possible today, but being a realist, before this is available for you, Kevin, in your daily practice, it may be a year, it may be 3 years. Historically, whenever you try to make an early prediction with technology in healthcare, you're wrong by years or decades. And so, I will certainly do everything in my power to figure out how we can get these tools trusted and in your hands faster.
And specifically with Epic, are they using a proprietary model or are they using GPT with their AI ventures?
Yeah, so Epic has actually done something pretty amazing. It's just kind of announced a big partnership with Microsoft, something we really haven't seen before, and even bringing Satya Nadella, Microsoft CEO, to the actual Epic developer conference, talking about the work that they're doing. And so they are developing all sorts of things, thinking about all sorts of things, and we'll see we'll see what gets launched and when. Epic is typically very conservative, usually isn't the fastest moving organization, but candidly, we've seen them move faster and partner more here than they have in other areas. So I'm cautiously optimistic, and they know that this is an important area for clinicians and for use across the country. Not that much is deployed today.
So one of the cautions I hear about these large language models is things like patient privacy, and they use some of this patient information to learn for future models. So talk more about that.
Yeah. So this is a big issue, and large language models and OpenAI is essentially trained these tools on the whole internet and has basically used that to learn associations to deliver the capabilities that amaze so many people today. The fear is that clinicians will put patient information or others, and that someone will find on the next release of GPT 4.5, oh my gosh, wow, I just found my entire patient record because someone put this in the public models, which they use to train on and then spit back out. So this is happening. I've just had conversations from interns to residents, attendees all across the country. People are using maybe their OpenAI app on their phone to record a message, record a patient note, put in PII even though they shouldn't, or they maybe try to avoid it. And some of this is going to end up in the next training run for these models. That should not happen. Let's be very clear. That is not allowed from our data standards, and we should not be using these public sources that train on our data. With that said, there are private versions where you can start to use these tools, and it doesn't involve leaking out training data to the public. So there are tools, they're not available, and at most institutions, they're not there yet, where it will be possible to use these tools in a secure way where you're not leaking patient information out to be trained on for the next release.
We're talking to Justin Norden. He's a physician executive. Today's Kevin MD article is, Can Generative Artificial Intelligence Help Clinicians Better Manage Patient Messages? Justin, let's end with some of your take-home messages, like to leave with the Kevin MD audience.
Absolutely. I think keep playing with these tools. This really is the future for where things going. Generative AI is the most transformative piece of technology I've seen in my career, and it will be available over these coming months and years in different respects across healthcare. The best way to learn is to start using these tools in your daily life in a different way. Figure out how to use this tool to write better emails, how to do it in non-clinical scenarios, which are far safer first, because this is going to be part of our daily lives.
Justin, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thanks so much for having me, Kevin.